Good evening, everyone. My name is Marcos Lopez. I'm a nursing student at Stanbridge University, located in Irvine, California. For my human physiology course, for my signature assignment, I am presenting anxiety disorders with a focus on CNS neurotransmitter imbalances. I would also like to notate for my audience that anxiety is not a weakness. However, it is a chemistry imbalance that's going on within the brain. So the disorder of chemical imbalance, anxiety disorders, what's occurring to the individual is that they are excessively worrying, overgeneralizing a thought about a situation that hasn't occurred, may not occur, or has yet to come into reality. Essentially, they are paying the toll ahead of time. And their mental perception of things is taking a toll. And so much that it could interfere with daily life. They can neglect relationships, loved ones, personal hygiene, mental, physical health, even their daily routine in their life. It's just all misconstrued. It's all in a tangled mess. And the dysregulation in the brain's neurotransmitters, there's a high chemical imbalance that the nervous system's alarm is over responding to it. So please accompany me as I go to explain the anatomy, physiology, pathophysiology, diagnosis and treatment, accompanied by AI, and the US and the demographics, the US and the global scale. So the fear circuit of the limbic system, the amygdala is the fight or flight response when it sees the danger. Your prefrontal cortex is your personality, executive function. This is where all top executive function from the top down goes into play. And it tries to calm the amygdala the best it can. How strong is your mental fortitude? The hippocampus provides context in helping distinguish from safe, dangerous, kill or be killed. Is it going to eat me? Can I eat it? And that's a more primal way of thinking about it. But it provides context in hopes to also calm the amygdala as well. And then the hypothalamus is a hormonal chemical response that converts the fear into a hormone signal that goes out to the rest of the body. A wide body stress response. Do notate the hypothalamus, thalamus, with the arrows in the amygdala body and hippocampus. So from neuron to synapse to stress access. Neurons, when they pass the synaptic cleft, they meet but they never touch. And also in this place of the neuron, this is where treatment drugs and other both chemical imbalance take place. The HPA axis, the hypothalamus, pituitary, and the adrenal gland, is the hormonal activity that releases cortisol, the stress response throughout the rest of the body. And for the record, I want to notate that CRH is pronounced corticotropin, and ACTH is pronounced adrenocorticotropin. So normal signaling, the accelerator versus the brake. The accelerator is overfiring the excitatory of the neurotransmitters. The glutamate, acting as an accelerator, it's excitatory. It activates neurons and drives the brain's alertness and threat response into overdrive. The GABA, serving as a brake, is the main inhibitory neurotransmitter. It opens the chloride channels, quiets the neurons, and dampens the amygdala's alarm. Not until there's recycled transporters that will take these signals and recycle them to, to the sending neuron to cleanly shut off the amygdala's alarm system. So during the modulators and the stress feedback loop, the serotonin, the feel-good hormone, strengthens the prefrontal cortex's ability to regulate the amygdala. Norepinephrine drives arousal, vigilance, and physical fight or flight response. As for the HPA axis, the stress coming from the fear, the hypothalamus releases CRH, the pituitary releases ACTH, adrenal glands release cortisol. Cortisol then signals the brain to shut off the response, the negative feedback restoring homeostasis. When the brakes fail in anxiety disorder, the excitatory inhibited neurons are overfiring on the amygdala's alarm system. And the prefrontal cortex from the top down has lost all executive function. In this response, the person may be unable to make decisions, unable to speak, may have a panic attack, or they may be hyperventilating. They are essentially unable to control the imbalance. The reduced GABA activity weakens the brakes, so neurons in the fear circuit overfire. The excess glutamate pushes and amplifies the alarm, the amygdala. And the amygdala hyperactivity overreports and overfires about the threat. The prefrontal cortex fails to identify it. And there's essentially, even though there's nothing in front of them, the fear and the anxiety is excessively hypering the danger, even though there's no real danger in front of them. This explains the hallmark signs and symptoms such as, sweats, shaky voice, lack of confidence. I don't know, that's not essentially a symptom. But the persistent excessive worrying and out of proportion thinking is a strong signal about anxiety. The imbalance, so specific symptoms: low serotonin, low mood, very drowsy, sluggish. Think of Eeyore, Winnie the Pooh. Maybe very easily agitated, irritable. The excess norepinephrine, that would increase overdrive of arousal. So sweating, elevated heart rate, elevated breathing, possible shakes, unable to calm their nerves. And hypervigilance, the excess worrying. The HPA dysfunction, the feedback loop is out of whack. It's failed to keeping the cortisol high. Its failed feedback keeps the cortisol high, and it's disrupting sleep, fatigue, focus, memory, and being in this constant stress state could also lead to other complications, because stress is also the silent killer, number one silent killer. To diagnose someone with anxiety, you have to do a screening. You can't just give them a lab test. And it has to be under the DSM-5 criteria. And it has to be chronic, so it has to be 6 months longer for someone to be diagnosed with anxiety. And so, as I mentioned, you can't use a lab test, but you can use screening tools such as the GAD-7, MMPI, MCMI, and a clinical interview with a psychologist or a nurse practitioner. Rule-outs for anxiety would be physical causes such as cardiac complications, thyroid disease, stimulant use are excluded. Anxiety disorders are highly treatable as well, yet only 1 out of 4 people who need it can receive it. And this will be a recurring statistic throughout my speech. In the pharmacology to restore that imbalance, for your brain to be balanced, the patient can take SSRIs or SNRIs, serotonin uptake inhibitors. It blocks the reuptake transporters. So serotonin, so I mentioned the ones that get recycled, it blocks them. So serotonin and norepinephrine remain in the synapse longer, gradually restoring signaling. However, this can take several weeks to work. The benzos, the GABA receptors are agonists, enhance the inhibitory brake for rapid relief, but risk tolerance and dependency on the medication. And with too much of these medications, it can also impair their decision making, or they may not even be able to recall certain situations that have happened. Buspirone, a serotonin partial agonist, for chronic anxiety without the effects of the benzos. So without that sedation effect or that drowsiness. Beta blockers are adrenergic antagonists that the blunt physical symptoms that they can cure of the racing heart rate tremor or norepinephrine overdrive. Side effects and therapy prognosis. So there are a lot of side effects that can happen when taking medications that act on throughout the body. If they're taking serotonin, they could get nausea, the GABA enhancement brain-wide. It could also affect the drowsiness. Side effects are cost of non-target chemistry, pretty much. As for this CBT, cognitive behavioral therapy, this is talk therapy treatment that the patient will do with a psychologist or a nurse practitioner. And they will implement routines and structured guidance to help restore the prefrontal cortex for the function top down, their sleep, exercise, and they also want to reduce their caffeine intake. Anxiety is typically chronic, however, it's a manageable condition, but again, only 1 out of 4 people get the treatment that they need. As for AI diagnosis and treatment, it works as a supplement to kind of guide or give a bigger insight on what's occurring with the patient. It could also detect early anxiety risk through a system of questionnaires and speech that the clinician may upload their notes, upload the signs and symptoms or the things that the patient may say. They can also wear a heart rate, a brain scan wave, and a sleep monitor to flag an anxiety risk. Guided support through LLM-based chats are working as the supplement in between therapy sessions that the patient can talk and get a general sense of what they're experiencing, and the AI can kind of give them some feedback. The treatment planning is a predictive model that helps clinicians estimate the right type of medication. However, all these treatments are not to work as a replacement for humans, because human judgment and human decision making will always need to come into play when it's for medical patients, because you as a clinician, that patient, their mental well-being is in your hands, and you must make a strong decision on all the tools necessary to give them the correct treatment. Who's affected in the United States? 19.1% of the US adults had anxiety disorder in the past year. 31.1% will experience an anxiety disorder in their lifetime. And women are 2 times more likely than men to have anxiety. And this can occur in childhood or adolescence that can develop, and anxiety will start to progress as they get mature and they develop. On a global scale, 301 million people worldwide were living with anxiety. In 2019, if you remember what happened in 2019, it was COVID. There was a lot of anxiety going around. In the US, compared to global, anxiety is rated higher in higher income countries, partially reflecting better detection and less stigma. Mortality. Anxiety doesn't have a high mortality rate, however, it is the precursor to depression and suicide, So it's important for the patient to get their anxiety under control and manageable through all the tools at their hands to not enter a more severe mental disorder, such as depression and suicide. And again, the treatment gap, only 1 in 4 people are affected by anxiety receive care. Lastly, I want to notate that anxiety is a manageable and treatable disorder. It is not a weakness someone is experiencing. It is a chemical imbalance, and that they just need some guidance and some navigation and the right tools with structure and discipline to get through their anxiety. Because in doing this, they will also understand the biology, and with more introspect, self-reflection on their self, they will understand their anxiety and conquer it. My name is Marcos. Thank you for tuning in, and I appreciate your time. Good night.